Welcome to the Deep Dive, your shortcut to being well-informed fast. Today, we're plunging into a topic that's incredibly fundamental to human life, yet, surprisingly, often shrouded in silence, shame, and misunderstanding. We're talking about the vagina and the broader female body. Our mission in this deep dive is really a re-education. We want to cut through the widespread misinformation and, the societal stigmas that have held back understanding, health, and empowerment for so many. And when we say female body, we are thinking broadly here. We acknowledge that not everyone with a vagina is a woman, and not all women have a vagina. It reflects the beautiful spectrum of human experience. We've dug into a stack of sources that reveal some truly astonishing and sometimes, frankly, unsettling realities. It's all designed to arm you with accurate, empowering knowledge.
It really is quite remarkable, isn't it, when you stop and think how little many of us are actually taught about our own bodies, especially the vagina, right, from a young age. This lack of knowledge often starts really early. It shapes this narrative that encourages us to basically ignore a huge part of our anatomy, almost like it shouldn't be there.
That front-bottom narrative you mentioned from the sources, it really sets the stage for a lifetime of discomfort, doesn't it? We're often told, sensibly it's a private place, but then it's like, don't talk about it again until maybe periods or pregnancy prevention come up. It's a silence that just speaks volumes.
And what's truly concerning, I think, is that there seems to be this real societal fear around giving girls the actual facts about their own bodies, almost as if giving them this knowledge would empower them in a way that, well, society isn't quite comfortable with. There's this anecdote in our sources. A Tampax representative during a school talk just innocently suggested to a group of 12-year-old girls that, it might be useful to look at their own vaginas with a hand mirror. Their response, just murmurs of disgust, outright ridicule echoing through the hall. It signals this horrified aversion to intimacy with their own bodies.
Wow.
It's a chilling illustration, really, of how deep this discomfort runs.
That story just lays it bare, doesn't it? The deep-seated societal discomfort we're really up against. So our deep dive today is precisely that, a re-education. We're here to fill those knowledge gaps, challenge the common fallacies, and hopefully empower you with accurate, inclusive information covering multiple perspectives.
Yeah, and building on that, the foundation of all this misinformation often starts with traditional sex education. What we found in our sources is that sex ed often heavily emphasizes, well, men's orgasms and male ejaculation. They even focus on things like wet dreams, which, let's be honest, are pretty useless when it comes to procreation. Meanwhile, female pleasure, female orgasms, rarely discussed. It effectively frames the male orgasm as pretty much the point of sex.
Right. And it's not just about what's taught, but also how it's shown. Like those anatomical diagrams we all remember from school, what we uncovered is, frankly, shocking. These drawings are often just wildly inaccurate. They show perfectly symmetrical labia, which is actually pretty rare. They draw the vagina like an open tube when its walls usually touch. And crucially, the clitoris is shown as just this tiny button, completely ignoring the significant internal structures, the shaft and the crura, that go way beyond what you can see.
Exactly. And these pervasive anatomical fallacies, they have profound real-world consequences. When accurate information is obscured, harmful myths just fill the gaps and stigma flourishes. This leads to a situation where many women feel this deep sense of shame or inadequacy about their own bodies. For instance, our research highlighted labiaplasty. It's the fastest-growing cosmetic surgery, often sought to correct perfectly normal asymmetrical labia.
Wow.
And this isn't just about a surgical trend. It's a stark illustration of how deeply this misinformation about what's normal drives women to literally reshape their bodies,
Right.
influenced by images that are themselves anatomically false.
Yeah.
It also contributes to women, maybe foregoing orgasms entirely because they were never really encouraged to understand or seek their own pleasure.
It's an incredible cycle of misunderstanding. So, okay, let's correct some of these fundamental misconceptions right now. What is the true vagina? How does it actually work?
Well, okay, the vagina is a muscular tube, typically about 7 to 10 centimeters long. Most of the time, its walls are actually squeezed against each other. So yeah, not an open hole like you see in so many diagrams. It's designed to expand dramatically, both lengthways and widthways, during arousal and, of course, during childbirth. Our sources mention it feels kind of bumpy or ridged to the touch, and it's remarkably self-cleaning, producing moisture through glands and seepage. And crucially, it's a closed system. It's impossible to lose anything up there beyond the cervix. Things don't just disappear.
Okay, that's really important. And what about the clitoris? You mentioned it's vastly undersold in those diagrams. What does the latest research tell us about its true anatomy and function?
Oh, it's profound, really. When you're taught your clitoris is just a tiny button, it inherently devalues female pleasure, right? Makes it seem secondary or simplistic. The truth as pioneering research by people like Helen O'Connell has shown, is way more complex and powerful. The clitoris isn't just that small bit you see externally, it's more like an iceberg. It has massive internal structures called crura. You can think of them as hidden legs that extend deep inside the body, wrapping around the vagina. They range from 5 to 12 centimeters in length. This entire structure can swell by 50 to 300% when engorged.
300%, wow.
Yeah, this extensive hidden structure is the true powerhouse of female pleasure. And that interaction between the clitoral crura and the front wall of the vagina during arousal, that might well explain why some women report having what's often called a G-spot.
That's genuinely eye-opening. So this isn't just about anatomical accuracy, it's about fundamentally reevaluating how we understand female pleasure. Which brings us to a significant and, let's face it, often uncomfortable truth: the orgasm gap. The numbers you found from that 2017 U.S. study are pretty stark.
They certainly are. So this study, surveying over 50,000 people, found that 95% of straight men reported usually or always orgasming during sex, but only 65% of straight women did.
65%, that's a huge difference.
It is. But then look at lesbian women. 86% reported usually or always reaching orgasm. This suggests it's not some biological flaw in women, it's more a systemic failing in how straight sex is often practiced and prioritized. It highlights a critical imbalance in pleasure. What's overwhelmingly clear from the research is that for most women, clitoral stimulation is the most reliable path to orgasm. It kind of dispels the unnecessary complication of trying to divide orgasms into vaginal versus clitoral types. It's often just about the clitoris being stimulated directly or indirectly.
It sounds like society has maybe overcomplicated something that biologically should be more straightforward to understand. The sources described orgasm as the calculus of desire, suggesting it's not always simple or obvious, though.
Oh, it's definitely complex and deeply individual. There's no single formula. The writer Roxane Gay, for example, she described her own experience of regularly faking orgasms. She said she just couldn't bring herself to explain the specific components necessary for her. It highlights how reaching orgasm can feel, well, cringingly personal, maybe even more private than our naked bodies sometimes.
That feeling of, cringingly personal discomfort often extends to the outward appearance too, doesn't it? It's kind of wild to think how something as universal as pubic hair has become such a battleground of cultural norms and personal choice. Our sources highlight this huge cultural normalization of pubic hair removal in the developed West. Half of all women under 35 in the UK, for example, apparently have regular Hollywood or Brazilian waxes, removing all or most hair.
Yeah, and this contrasts really sharply with other cultures, like South Korea, where our sources mention pubic hair transplants are actually celebrated as a symbol of fertility.
Wow, transplants.
Exactly. The debate around removal often circles back to feminism,
Right.
Is it patriarchal pressure forcing conformity, or is it genuine personal choice? It's interesting that the sort of default vulva in modern porn is often completely bald, which certainly contributes to pressure and self-consciousness about any perceived imperfections, creating this idea of a norm that's actually far from universal or natural.
Okay, so moving on from anatomy and pleasure, let's turn to another fundamental yet often shrouded experience: menstruation. It's a biological reality affecting billions, yet it remains steeped in silence and misunderstanding. The average age for a first period is around 12, with about 13% of girls starting by age 11. But for many, that first experience is incredibly traumatic. Why? Often just a shocking lack of knowledge.
Yeah, even with supportive families, a first period can be deeply distressing. And this distress, it stems not just from the unexpected blood, but also from these deep associations with womanhood and all the stigmas that come with it. The biological realities of periods like pain and mess, they're often tragically compounded by cultural, social, religious, and economic forces. It makes a totally natural process far more difficult than it needs to be.
Let's get into those period blood realities for a sec, because there's a lot of misunderstanding there too, right?
Yes.
Even for people who've been menstruating for years.
Definitely. Period blood can vary quite significantly, and just understand these variations can ease a lot of anxiety. Brown blood, for instance, usually just indicates older blood. It's had more time to interact with oxygen, maybe the flow is slower. Bright red blood typically signifies a quicker, heavier flow. And it's also completely normal to have occasional clots, especially on heavier days. Though if you're consistently passing large, frequent clots, that's definitely something to chat with a GP about.
Okay. And then there's the pain. Our sources describe really intense, debilitating cramps, the kind that can wake you up in the middle of the night feeling giddy and hot-headed from the agony pulsing through your lower abdomen, spreading down your legs. They mention finding relief maybe by getting on all fours, pulling the stomach in, or just sitting bent over on the toilet. Hot water bottles helping almost as a distraction.
And this profound biological reality of pain is often intensified by stigma. Roughly a quarter of the world population menstruates, and that includes trans men and non-binary people too, of course. Yet it often remains this secret, private suffering endured with quiet stoicism. It's still far too rare for periods and their symptoms to be spoken of openly in workplaces, schools, or just, wider culture. The examples in our sources from extreme banishment in Nepal to the subtle yet pervasive shame in Western schools, they paint this global picture. Menstruation is universal biologically, but its experience is tragically shaped by these deeply entrenched cultural and religious stigmas.
It's such an oppressive silence. I mean, imagine being forced out of your home, banished to a small, isolated hut during your period. That's the devastating reality of chapati in parts of Nepal. A tradition that, even though it's outlawed, still tragically leads to deaths from exposure, snake bites, asphyxiation. It's a chilling reminder of how deeply stigma can literally endanger lives.
Indeed. And the discomfort is so far-reaching. A 2018 report found that in some Catholic and Protestant schools, tampon use was seen as contentious because of its association with sexual maturity. Muslim women are not supposed to pray or fast during their periods, which can lead to self-consciousness. Our sources highlight that in U.S. prisons, tampons and sanitary towels have actually been used as bargaining chips, leading to humiliation and health crises.
That's awful.
And in Odisha, India, a staggering 20% of girls miss school because of their periods. 35% of disabled girls are affected. It directly impacts their education, their future.
All these factors clearly just worsen an already challenging biological reality. What about the idea of period leave? Is that something that could help? Is it being adopted?
Period leave, so legalized time off for menstrual cramps. It is a reality in some places, but it's not always straightforward. Japan, for example, has had it since 1947, but very few women actually use it. Why? Fear of stigma or sexual harassment.
Right.
In the UK, a company called Coexist implemented a policy back in 2016. It sparked huge international media attention, which really highlighted both the potential but also the ongoing challenges around normalizing menstruation in the workplace.
This really brings us to a broader systemic issue, doesn't it? The unacknowledged pain in women's health and this pervasive medical bias. It makes you wonder, how many times has women's pain just been dismissed, labeled as an overreaction, when the real issue is a medical system that wasn't really built with their bodies in mind? That, quote, woman is a pain that never goes away, seems to capture the essence of this problem somehow.
It absolutely does. There's this pervasive idea that being a woman just involves putting up with pain, that it's expected, something to be endured and borne with discretion. Women's pain is often profoundly misunderstood, underestimated, and minimized by the medical system. The author's own experience with a hysteroscopy, detailed in our sources, is a really stark and deeply troubling example of this.
She describes having unexplained vaginal bleeding, right, and being repeatedly dismissed. STD tests negative, smear clear, fibroids apparently not the cause. When she finally had the hysteroscopy, that's the procedure, with a camera on a tube inserted into the uterus, she was given inadequate pain relief. Despite her protesting, saying it's really, really painful, the procedure just continued. She felt like she's going to pass out, but, believed the doctor knew better.
And afterwards, the discharge letter actually labeled her a patient particularly sensitive to pain.
Oh, come on.
It illustrates this concerning cultural difference in pain management that is, frankly, alarming. Our sources highlight how U.S. doctors might insist on general anesthesia for a hysteroscopy, while UK guidelines might just recommend a local anesthetic, expecting women to sort of take it on the chin and be grateful for any attention at all. It really emphasizes how different healthcare systems view and respond to female pain.
It is shocking. And the root cause seems to be that medical evidence is overwhelmingly based on studies of men carried out by men, which leads to insufficient data on how women react differently to pain, to medication, to everything.
Exactly. And this systemic neglect means conditions that primarily affect women are just frequently minimized or misdiagnosed. Take endometriosis, for example. It affects 1 in 10 reproductive age women. This is where tissue similar to the uterine lining grows outside the womb. It causes severe pain, missed work, depression, anxiety, infertility. And the shocking average diagnosis time, 7 to 8 years.
7 to 8 years.
Yes. It's so prevalent, yet so often ignored, that NICE-T, the National Institute for Health and Care Excellence in the UK, actually had to issue a direct guideline telling doctors to listen to women presenting with
Just
symptoms.
listen. Basic. And then there's vulvodynia.
Right, vulvodynia, a chronic vulval pain condition described as a stabbing, shallow pain that can make sex, or even just sitting, excruciating. One woman, Rachel Rivez, shared her experience of being dismissed by doctors, even blamed for lack of hygiene. She only found relief through a specialized private physiotherapist, even though there's still no known cause or cure.
Unbelievable.
And another often misunderstood condition is vaginismus. This involves involuntary vaginal muscle spasms. It can make tampon use or any form of penetration painful or impossible. Shelby Haddon, who made a film about her experience, recounted doctors giving useless advice like, oh, just drink some alcohol, or flat out refusing to examine her if she wasn't sexually active.
Wow.
It highlights this profound lack of understanding within the medical community about conditions unique to female bodies.
This really underscores the critical importance of proactive health measures like HPV vaccination and cervical screening. The HPV vaccine, introduced in the UK for girls in 2008, then boys in 2019, has been a massive success in preventing cervical cancer.
An unmitigated success, yes. However, it's vital that all women, even those who are vaccinated, continue to get regular cervical screening. A vaccine doesn't protect against every single strain of HPV that can cause cancer. Alarmingly, screening rates have actually declined recently, and there's even been opposition to the vaccine based on what our sources bluntly call anti-sex misogyny, meaning framing these vital preventative measures as somehow encouraging sexual activity rather than what they are, purely protecting health.
Right. Okay, so this systemic neglect, this pervasive bias, it isn't just isolated to pain management. It seems to permeate discussions around fertility, motherhood, really every stage of the female life cycle. Let's dive into those often unspoken realities now. It's interesting how sex ed focuses so much on preventing pregnancy, but leaves people totally unprepared for the challenges of actually trying to conceive.
Indeed. The author's personal journey, which she shares in the source material, illustrates this perfectly. She expected conception to be easy, straightforward, and was shocked to find herself among the unlucky 16% of couples who don't conceive after a year of trying. She describes the emotional toll, the negative pregnancy tests month after month, the pervasive feeling of failure, the stark reminder that fertility isn't guaranteed and the journey can be deeply personal and often difficult.
And there are just so many taboos around discussing fertility and infertility, aren't there? It seems compounded by society's general squeamishness around vaginas, wombs, sex, and also the difficulty of talking about perceived failures in something seen as so fundamental.
Exactly. What's fascinating here, though, is that experts like Hepburn, mentioned in our sources, are advocating for much better fertility education, and even suggesting things like egg freezing loans for young women, similar to student loans.
Egg freezing loans.
Yeah, the idea is to empower women with knowledge much earlier. Because eggs, and childbirth itself is surrounded by this curious silence when it comes to the nitty-gritty, as one source put it. We often hear this simplistic, uniform narrative that completely ignores the wildly different experiences women actually have. Rebecca Schiller, founder of Birthrights, points out that because nobody really wants to talk about vaginas, the only way to discuss birth seems to be to simplify it, rather than acknowledging that everybody might have completely wildly different experiences.
One historical example of this kind of oversimplification, or perhaps over-medicalization, is the episiotomy.
Yes, the episiotomy. Introduced way back in the 18th century, it became incredibly common by the 1930s. It peaked at something like 63% of vaginal births in the U.S. by 1979, despite pretty unconvincing evidence that it was actually beneficial. Doctors often minimize them, calling it just a little snip, really downplaying the seriousness of a surgical cut during childbirth.
But there was pushback.
Oh, yes. Influential figures like Sheila Kitzinger, who founded the National Childbirth Trust in the UK, were instrumental. They opposed the sort of routine medicalization of childbirth, advocating strongly for women's preferences and questioning interventions that were introduced without proper assessment.
And cesarean sections, C-sections are also a hot topic. Global rates are rising dramatically. Over half of all births in Brazil now, apparently.
Yes, the rates are climbing globally. The World Health Organization advises against them unless they are medically necessary due to the associated health risks for both mother and baby.
So it's complex.
The discussion here is incredibly nuanced. While rising global rates definitely suggest a public health concern that needs looking into, it's crucial not to conflate this with an individual woman's human right to choose her method of birth. Women should be trusted to make the best decisions for their bodies and their babies based on clear, impartial information. It has to be about empowerment through knowledge, not judgment from afar.
Absolutely. And the pain doesn't necessarily just stop after the birth either. Our sources show that almost 90% of women who give birth vaginally experience some tearing or have an episiotomy. This can lead to pain that makes sitting and especially breastfeeding excruciating for a month or even more.
And pain relief options are often quite limited for breastfeeding women, usually just paracetamol or ibuprofen. Many women report feeling like they're overreacting when they ask for something stronger, despite the significant trauma their body has just undergone. It's another example of female pain being minimized.
Right. And then we come to menopause. Often presented with really starkly contrasting views in our sources. Some women find it great, maybe especially after decades of period pain. But for others, it's described as a 10-year-long ordeal with brutal symptoms.
Yeah, the experience varies hugely. Symptoms generally begin in the mid-40s, with the average age for the final period in the UK being 51. The symptoms themselves can be pretty bleak for many. Hot flushes, a constant urge to pee, vaginal dryness, mood changes, impacting sex life, work, mental health. And genitourinary syndrome of menopause, or GSM, that's the newer term for what used to be called vulvovaginal atrophy, affects up to 50% of women, causing significant dryness and discomfort.
And similar to what we discussed earlier with pain, there seems to be this troubling medical apathy around menopause, too. A 2016 survey found half of women don't even consult doctors for menopausal symptoms. Why? Because they feel they just have to put up with it.
Exactly. This pervasive apathy, combined with ageism and misogyny, creates really unsupportive workplaces. A quarter of women actually consider leaving their jobs because their symptoms are so debilitating and unaccommodated. Our sources strongly advocate for menopause policies to be considered right alongside things like menstrual leave, thinking about practical issues like hot flushes in a stuffy office or the constant urge to pee when there aren't enough accessible toilets.
It also brings up the controversial topic of vaginal rejuvenation treatments for dryness. While some might dismiss it as a luxury or even exploitation, one surgeon, Dr. Jacqueline Lewis, explains she offers it to patients who cannot be prescribed estrogen, maybe due to cancer history, like breast cancer survivors put into early menopause by treatment.
Right. She balances that concern about potential exploitation with the very real need for effective treatments for those who can't use traditional methods. Treatments beyond just, as the source puts it, KY jelly and mini fans. It's really about ensuring women have safe and effective options and that their legitimate needs aren't dismissed because of a certain sniffiness around discussing or funding treatments related to vaginas or menopause.
So, to truly achieve this re-education we're talking about, moving beyond the binary seems absolutely crucial. We really need to acknowledge that not everyone with a vagina is a woman, and not all women have a vagina. Younger generations especially are increasingly reluctant to see sex and gender as these fixed binary concepts. Our understanding needs to evolve with that.
This is highlighted further by the existence of intersex individuals. Estimates range from 0.5 to 1.7% of people. These are people born with sex characteristics, genitals, chromosomes, hormones that don't neatly align with typical binary notions of male or female. There's also a growing mistrust, rightly so, of those early, often non-consensual sex assignment surgeries on newborns, acknowledging the complexities here.
And when we recognize trans rights, we understand that trans men who have vaginas might experience specific gender dysphoria during periods or even during cervical screenings. This adds another layer of complexity and a specific set of challenges for their healthcare and their overall well-being.
Yes, and it's incredibly important to reject this notion that caring about vaginas somehow means not caring about trans rights. Our sources explicitly call suggestions like that deeply misogynistic. Janelle Monáe's Pink video is mentioned as a fantastic example. It's this empowering ode to the vagina, but it celebrates that anatomy without diminishing any other experiences.
The evolution of language is also part of this ongoing learning curve, isn't it? Terms like people with cervixes used in screening campaigns. The intention is obviously to include non-binary people and trans men. Our source acknowledged that intention is good, but maybe not everyone immediately understands it. They suggest phrases like women and people with cervixes might offer more clarity for now. It's recognizing that we're all still learning how to be truly inclusive in our language.
Absolutely. An education that recognizes gender and sex aren't always binary, that they exist on a spectrum, and acknowledges the specific challenges faced by diverse individuals. That doesn't diminish care for anyone else. In fact, it deepens our understanding of the whole human experience.
So, as we wrap up this deep dive, it feels clear we've traveled a long way from just talking about the front bottom. But gosh, there's still so much work to do. We've navigated this landscape of misinformation, societal pressures, systemic biases, really highlighting the critical importance of accurate, inclusive understanding of the vagina and the female body in all its
Yeah,
forms.
despite progress, landmark rulings like Roe v. Wade back in 1973 legalizing abortion in the U.S., though that's complex now too, there's still so much more to learn, to teach, and frankly to question, especially with new challenges emerging from the internet, from tech companies that often profit from our bodies and our insecurities.
The power of knowledge and just open conversation seems undeniable, though. Our ability to talk openly about these topics without fear of being disparaged or misinterpreted feels vital for progress and for personal empowerment. It's really about creating a world where every individual with a vagina and every woman can truly understand, care for, and yeah, celebrate their body without shame. Let's keep talking, let's keep learning, and let's continue this essential re education